The World Health Organization, WHO, has made recommendations for the adoption of digital systems to promote efficiency in HIV programming. The Ugandan Ministry of Health has adopted this recommendation and in its 2018 guidelines recommends the use of informational technologies in the scale-up of antiretroviral therapy. WHO and the Ministry of Health have implemented UgandaEMR, OpenMRS, as a patient management system. However, the system is not web-based and there is no provision for inter-facility communication. Secondly, the UgandaEMR software is a desktop application and cannot run on mobile smartphones. This makes it impossible for real-time data entry at drug distribution points. ArtAccess is a web-based application that links patient health information such as viral loads, their HIV treatment regimen, and streamlines art delivery to private pharmacies in Kampala.
It was a little bit hard because of the number of clients are too many. So whenever you do come, you have to take almost the whole day. And when it comes to going to pick the drugs, the line was always very long.
The rapid scale-up of antiretroviral therapy has been challenging in very many countries, including Uganda. It has led to overcrowding in facilities. There's now so many patients accessing antiretroviral therapy. And the Ministry of Health, together with WHO, advised countries to implement differentiated service delivery models. And these models allow patients to access antiretroviral therapy outside the health facilities. So this could be community places, but in the context of IDI, because it serves an urban population, IDI worked with private pharmacies to be ART delivery points for health facilities. So the health facilities must provide antiretroviral therapy at the facility itself, but they must also provide antiretroviral therapy at the private pharmacies.
This project, ArtAccess, seeks to address the barriers of private pharmacy engagement in care and catalyze the operationalization of differentiated art delivery. However, there is limited data on the impact of integrated patient management systems on patient experience with care and treatment outcomes. The cost-effectiveness of these systems has not been described.
My doctor realized that my viral load was very low after taking a viral load. She advised me that, you know what, we are going to change you. We are going to put you to a pharmacy community refill. And I was like, okay. But it was after her realizing that my viral load is very low and I'm taking my drugs very well. I'm not missing my appointments.
Ideally, we need a patient who is stable on ART, that is antiretroviral therapy, and those clients are supposed to be having a suppressed viral load to start with, and with a suppressed viral load we mean a viral load less than 1,000 copies per mil according to the Uganda Ministry of Health guidelines. And also we need a patient who's taking their medicine very well. They have a good adherence of 95 and above %.
ArtAccess is a tool that tracks clients on community pharmacy program, and these are basically 2 pharmacies for Kawala Health Center, 3, and that is Shubi Pharmacy that is stationed in Kawempe, and then Seda's Pharmacy that is stationed in Nankulabe. The 2 pharmacies, ideally they help the clients have easy access to their drugs, and they don't have to spend a lot of time at the facility like it was before.
When we are accessing the tool, everything is done there and then. We summarize, we make the next appointments there and then. You don't need to go and peruse through the books, all the books we use, because there are around like 6 books. But for the access tool, everything was managed in a way that you can download the patient's work, and all the evidence, the next appointments, all is being formatted in the tool. So you need to just capture everything there and then, make their appointments there then. If there's someone who has come here without the next appointment being scheduled for the pharmacy, you are able to see it there and then before you go through the books. Like in January, you go in the book of January or December last year. So you are able to click on the patient, then you get the information and you summarize everything.
Initially, as a facility, we didn't really have a real tool that could actually track those clients. If someone came and asked her, how many clients do you have on the pharmacies, you have to first go back to the registers, paper-based, which is a bit tricky because there are very many, and sometimes counting one by one takes a lot of time. Yet with the access tool, you actually just click somewhere and then you get to know how many patients you have per pharmacy. Then it also helps know how many clients you're expecting at the facility, which was actually not there before. When you go back to those registers, you can't really know that this is a community pharmacy client coming back to the facility.
Now, that tool, we use it, first of all, close monitoring of the clients. From 1 to, because we have almost 1,000 plus clients. So we use it to monitor them right from what they think they are, what their complaints, the challenges they are facing, and even getting their medication. So you find when that our output and input has increased.
If you have patients like in the next 2 weeks, you are able to know the number you have. As long as you click there in the data, in the access tool system, you're able to know that you have like 50 clients for the next 2 weeks. Then you order the drugs accordingly. All the data is already put in the access tool, and you're able to order for the requisition, make the requisition when you're just on the chair.
So we designed this application to allow us to be able to synchronize data at the private pharmacies, at the first facility, so as to allow us get a feel of the real-time status of patient engagement in care, get to know in real time the status of antiretroviral therapy stock status.
It has helped me so well because as a teacher, you know, our schedules are always very tight. You need to be there at school. So this one has helped me. I can go there within 5 minutes. I'm served, I get my drugs, and I go and attend to my students.
The impact of this pilot will be to cement the use of mHealth technologies as a system strengthening opportunity, allowing policymakers, HIV care implementers such as NGOs, funding bodies, and commercial companies to creatively think of technologies they can employ. This care cascade is of vital public health importance. Starting on art and reaching an undetectable HIV viral load through good adherence reduces mortality and onward transmission of HIV.
So our plan is to scale up to all private pharmacies that are enrolled, that are part of the greater IDI KHP project. And our ultimate vision for this program is to allow every patient in this country to access antiretroviral therapy at any health facility they go to. And for us to do that, we must deploy this application at all the HIV facilities in this country, so that if a patient makes a visit, for example, they receive antiretroviral drugs from Kampala, when they go to Gulu, they can go to any facility in Gulu and get the antiretroviral drugs. And real time, their primary HIV service provider, which is a clinic in Kampala, would know that our patient has completed a visit in Gulu, rather than, following up with phone calls or going to look for the patient, thinking the patient is disengaged from care when they're not. That is where we are heading. And this is part of our bigger goal to automate HIV service delivery in this country.